Do's and don'ts. It is very important that you clearly understand how to handle confidential information and understand how to protect your client, yourself, and your agency. Make sure that any information about your client is not written down and brought with you outside of the agency. Never bring information about another client into your current client's home. Even though you may feel that this information is safe in your bag, notebook, or on your device, others may access this information while you are distracted or busy providing care. Never ask your friend or a family for a ride to a client's home. If you don't have your own transportation, discuss the matter with your supervisor. Never store clients' phone numbers or personal information in your cell phone, for if the phone is stolen, it is identifiable information. Sometimes, as you spend a lot of time with your clients, you may start to feel very close to them and wish to share funny anecdotes or share meaningful moments with your family and friends. Even very general conversations, however, might contain identifiable information that would be considered a breach of confidentiality. Never give out your client's phone number to family or friends. If there is an emergency, direct them to call your supervisor, who is in the healthcare team, and can contact you directly. Sometimes when caring for someone, things can get upsetting, or the passing of a client might bring you feelings of sadness or grief. If you feel the need to speak to someone about these feelings, be sure to reach out to someone that is in the healthcare team to discuss this. If more help is needed, reach out to a licensed therapist where a privacy agreement and where any information shared would remain confidential. Speaking with your family and friends about upsetting events, even during these times of sadness and grief, would still be considered a breach of confidentiality. Do not assume that it's okay to discuss your client's care with their other family members. Sometimes there are complex family dynamics where your client may not want their information shared with certain family members. You must have express consent from your client to share any information with anyone outside of the healthcare team. If a family member requests information, ask your client for permission first. If you receive any request for information or any backlash from family members, ensure that you speak to your supervisor about the situation right away.